Retinol can take 10 years off your face, or it can turn you into a molting snake, and the difference comes down to how you start using it. I see patients in the clinic every week who stop using retinol because it destroyed their skin, or people who are too afraid to start using it because of all the horror stories that they've seen online. So today I'm going to teach you how to use retinol the right way without looking like you got into a fight with a cheese grater. By the end of this video, you'll know exactly which retinol you should start with, how to introduce it without irritation, and the biggest mistakes people make that turn retinol from a miracle skincare ingredient into a skincare nightmare. Plus, I'll share the one thing that determines if retinol will work for or against you, and it's not what you think. I'm Dr. Dustin, I'm a board-certified dermatologist, and I'm here to help you cut through the skincare noise with actual science. If you want honest advice that empowers you to make smart skincare decisions without falling for expensive marketing tricks, then hit that subscribe button, because your skincare deserves more than trial and error. All right, let's start with what a retinol actually is, because understanding this will save you from making some expensive mistakes in the future. Retinol is a form of vitamin A. It essentially tells your skin cells to act younger. Think of it as trying to convince your skin cells to stay in their 20s, regardless of how old you start getting. Retinol is a broad family of medications. There's several different forms which we'll talk about, but they're essentially forms of vitamin A that tell your skin cells to act younger. Think of it like a life coach for your skin cells. They can boost collagen production, reduce fine lines and wrinkles, and help with unwanted pigmentation. Plus, they're commonly used for acne, so if you get the occasional blemish, retinol can be very helpful. Here's what happens when you use retinol consistently. Your skin cells are going to turn over faster, so say goodbye to dull skin. It can help to boost collagen production, so hello to more skin firmness. It can help to make your pores appear smaller because it helps to clear out some of the debris that piles up in your pores. With consistent use, you can notice decreased fine lines and wrinkles, so that is like a time machine in a bottle. And as I mentioned, if you tend to get acne, retinol is one of the most effective ingredients to help you avoid future blemishes. I know that all of this sounds amazing, so why doesn't everyone use retinol? Well, because it's like that best friend who gives great advice but has no filter. Overall, it's incredibly helpful, but if you're not ready for it, it can be a little bit harsh. The key to retinol success is to start slow. There's no awards you're going to win for going to the highest dose or going up to daily use right from the beginning. Start slow, be patient, and you're not going to end up like you face planted on some sandpaper. But before we talk about how to start, you need to understand the retinol family tree, because not all retinols are created equal. And as I mentioned, there's a whole family, and they kind of build upon each other from less intense to more intense. There's a number of over-the-counter options, and one of the first that you might see is called retinol palmitate. This is a great retinol for beginners or those who have incredibly sensitive skin. Retinol palmitate, when it gets converted to the skin, can become a retinol. There's still additional conversion steps that are needed before it becomes active, but you can skip that first conversion step by buying a retinol over the counter, which is the second kind that you'll find. Somewhere in the 2.5 to 5x range is really good for many people, but super sensitive people may not be able to tolerate a retinol from the get-go. The next over-the-counter retinol you might encounter is called retinaldehyde, and this has gone through additional conversion steps in the laboratory before it's packaged up. Retinaldehyde is probably better for more advanced users and those who are able to tolerate it and want to see better results. Retinaldehyde is one of those conversion steps that happens in your skin if you're applying a retinol, but you can also get retinaldehyde over the counter. And lastly, over the counter, you can find something called adapalene. The brand name for this was different when it was a prescription product, but several years ago it was made as an over-the-counter option, and it's one of my favorites to recommend for teenagers with acne who might not be ready for a prescription yet. But because it is a retinol, it has all of the same benefits that the other types of retinols have that we're going to talk about. Now that you understand the over-the-counter options, let's talk about some of the prescription options that are available, starting with tretinoin. This is classic retinoic acid. Tretinoin is biologically active when you put it on your skin, and it does not need to be converted into another form in order for it to start changing your skin. Tazarotene is another type of retinol. This is a third-generation synthetic retinol that is typically considered to be for more advanced users. It can cause more dryness and irritation if you're not careful. Tazarotene is generally considered strong by most dermatologists. And then there's trifarotene. This is the new kid on the block, and it only acts on certain retinoid receptors in the skin, and there's some nuance as to why you might choose that one. But when I see patients in the clinic, we have these conversations to decide, do we want tretinoin, tazarotene, or trifarotene? And that's beyond the scope of this video, but it gives you an understanding of what the prescription options options are, as well as the over-the-counter options that we've previously discussed. It can be useful to think of these different levels of retinol as spice levels at a Thai restaurant. When you first go to a Thai restaurant, you don't want to be asking for Thai level spiciness. You want to start low and then build up your tolerance to it. But again, you don't have to get to tazarotene or trifarotene in order to get great skin. The most important thing that you can do when using a retinol is find one that works well with your skin and use it consistently. If you're brand new to retinol, I recommend getting an over-the-counter retinol at a 0.25 or a 0.5 percentage strength. This is going to do well for most people without causing undue dryness. Now, before I give you my expert tips on how to start properly, I want to warn you about the biggest mistakes that I see people make when using retinol so that you can avoid them. Mistake number one is going too strong, too fast. This is a classic mistake where we think some is good, so more must be better. You do not have to jump into the strongest retinol right away. Even if you're very unhappy with your skin, maybe you have more fine lines and wrinkles, maybe you have more dark spots that you'd like to get them to go away as soon as possible. But I promise you, starting on a lower strength, making sure your skin tolerates it well, will give you better results in the end and will avoid those retinol scaries that get people to stop using it before they ever see results. Mistake number two is not using a moisturizer. I strongly recommend, especially when you are first beginning with a retinol, that you use a moisturizer every single night. Retinol can cause some dryness in your skin moisture barrier, and you want to replenish those things with a good fragrance-free moisturizer. And I've given lots of recommendations on my channel before. If you need a recommendation, leave a comment on this video and I'll respond with some of my favorites. Mistake number three is using retinol with other active ingredients. If you have a very basic skincare routine, I don't want you to start a retinol and a vitamin C and occasional exfoliation. I really want you to just pick that retinol and start using it consistently. When you've gotten to a place where your skin is tolerating it well, then we can talk about adding in some of the other actives that I commonly recommend. Mistake number four is not wearing sunscreen. If you're going to be using a retinol, you need to understand that it can make your skin more sensitive to the sun. When you start using a retinol, that top layer of dead skin cells called the stratum corneum actually starts to get a little bit thinner, and that's why your skin looks more bright and less dull, because you're getting rid of dead skin cells. But that also means that the UV rays can penetrate more easily on your skin and lead to aging or sunburns faster than they otherwise would. So if you're not using a sunscreen while you're using a retinol, you're not gonna see the results and you're gonna age faster than a banana left out in the sun. And the last mistake, probably the most common one, is quitting too soon. Many people that start retinol and are not gonna follow the advice I'm about to give will give up after about 2 weeks because of the retinol scaries. They might start getting a little dryness or irritation. Maybe their acne suddenly gets worse and they give up. You really need to give your skin 4 to 6 weeks to start to acclimate to the retinol and really start seeing the results that you want to see. So don't give up like most people, just don't be most people. So now that you're not going to make the mistakes that many people do make when starting a retinol, how do you start it successfully? I call this the turtle method. Slow and steady wins the race. Let's talk about what you're gonna do on weeks 1 and 2. This is the induction phase, if you will. If you've never used a retinol before, honestly, I want you to start using it just 1 time per week. I know that seems like you're not gonna get a lot out of it, and truly, retinol once a week isn't going to deliver amazing results, but you need to make sure your skin is tolerating it well. What you're gonna do is wash your face at nighttime, preferably with a gentle cleanser, not something that is an exfoliating cleanser. And after you've washed your face, I want you to dry it. Pat it dry with a towel and let your skin dry in the air for another 5 to 10 minutes before you use your retinol. If your retinol is a cream that comes out of a pump or a tube, you want to use a pea-sized amount. I explain to my patients every day in the clinic, take a pea-sized amount, dot your forehead, chin, cheeks, and nose, and then rub that in. Be cautious about getting too close to the eyes, the corners of the nose, or the corners of the mouth, because these areas are more likely to get dry and sensitive. About 5 to 10 minutes after applying your retinol is the perfect time to apply a moisturizer. So this is a good time maybe to brush your teeth or to do other things as part of your evening routine, because retinol should always be used at night. It doesn't play well with the sunlight. Many types of retinol can actually get broken down by the sunlight. So if you put it on, and especially if you're not wearing enough sunscreen and you go outside, the sunlight's going to gonna inactivate your retinol and you're never gonna see those results. During weeks 3 to 4, this is the tolerance phase. This is where you're gonna bump it up to probably twice per week. If you bump it up to twice per week and you're still experiencing some irritation, consider going back down to once per week for a few additional weeks, or maybe you need to go to a less potent retinol. So if you started with a 0.5 retinol over the counter, maybe go and pick up that 0.25 and then you can work up to the 0.5 over time. Just remember, you're not gonna win any awards for using a retinol that's stronger than your skin can handle at any given time. Weeks 5 through 8 of using a retinol are the progression phase. This is where you're gonna go from twice a week up to 3 times a week or every other day. Every time that you use it, you should be doing the same steps we talked about in phase 1 is wash your face, make sure it's dry, apply your retinol, and then apply a moisturizer. I also failed to mention that if your retinol is a serum, usually 4 or 5 drops in the palm of your hand, and then you'll dab your finger and then treat an area one at a time, and that's gonna be enough to cover your whole face. After about 8 weeks, if your skin is doing great with that every other night application, go ahead and try to use it every night. Essentially, the best results are gonna come from using the retinol that your skin tolerates well and using it as frequently as possible. Some people never make it more than 3 times a week, and that's totally okay. But if you can't tolerate it more than once per week, I definitely think you need to go down to a less potent retinol. And if even that is too much for your skin, I do think you should visit with a board-certified dermatologist because you might have other skin sensitivity issues. There could be allergies to preservatives in the formula, or you may have underlying rosacea or perioral dermatitis that needs to be addressed so that you can start seeing the skin that you want to see. So as you start using a retinol, what can you actually expect to happen in your skin over those weeks? I want to set some realistic expectations for you because Instagram is not reality. Weeks 1 through 4 are an adjustment period for your skin. You're putting something on your skin that's telling them to act in a different way, and sometimes they want to misbehave. Some people will experience some mild redness or irritation, and this is normal. You've got to make sure that you're using a moisturizer after you use your retinol. You can use a moisturizer before a retinol, but I discourage you from using what's called the sandwich method, where you put on a moisturizer, you put on a retinol, and you put on another layer of moisturizer. A study was done and presented at one of the conferences that I go to over the last year, and they showed that the sandwich method for retinol actually significantly decreased the impact of the retinol on the skin. So it was totally fine to moisturize once before or once after, but just don't do both. Some people might experience some slight flaking of the skin, and in this case, make sure that you're not using too much retinol. If you're using more than a pea-sized amount or more than 4 or 5 drops of a serum in your hand, you need to back off. More is not better when it comes to retinol. For some people during this adjustment period, they may also notice an increase in acne. If you're getting an acne bump, it's one of those things that probably started 3 to 4 weeks ago underneath the skin. And retinol, as it turns over your skin cells faster, may actually bring things up to the surface a little more quickly. Don't get discouraged if you notice a few more breakouts. If you stay strong with the retinol, you keep going at your pace, things will get better. During week 6 to 12 of using a retinol, this is where you're gonna see that improvement phase happen. You're gonna notice improved radiance to your skin, less dullness. You're gonna notice fewer fine lines and wrinkles, and maybe some of those dark spots are gonna start diminishing. Some of that acne should start to resolve during this time as well as you go from week 6 to 12. And if you've been patient through this point, and now we're hitting month 3 through 6, this is where the real results are actually gonna come. You can see significant improvement in fine lines and wrinkles and significant diminishment of the brown spots on your skin. There should be far less acne and an improved appearance of your pores. Remember, you can't actually shrink your pores, but you can make them look better by being less congested, and retinol is excellent at doing that. Just remember, as you get started with a retinol, it is a marathon, not a sprint, and you are not in competition with anybody else. So if somebody started using a retinol and they got to using it every night after 3 or 4 weeks, you're not doing anything wrong if you can't tolerate it that fast. If they're seeing results in 2 months, be patient. Your results may take longer, 3 to 6 months, but it's worth it if you continue to use it regularly. I've been using a retinol for close to a decade now, and it's one of the essential things in my skincare routine that I almost never skip. Now that you know the mistakes to avoid and how to actually start like a pro, I'm going to give you some product recommendations for beginner, intermediate, and advanced retinol users. We've got some budget-friendly beginners, and this is the CeraVe Resurfacing Retinol. This one is great for beginners because it has ceramides to help hydrate and repair the skin barrier. It is a gentle retinol, and I have used this before. I personally didn't see amazing results, but I'm an experienced retinol user, and my skin has been used to retinol for, again, 10 years. So This was a little bit on the weak side for me, but again, if you're brand new to retinol, it actually is a great option. Another budget-friendly option is going to be the ordinary 0.2% retinol in squalane. Squalane is an important lipid for your skin, so again, it's got ingredients to help hydrate the skin, and ordinary is a great budget-friendly option. It's definitely not going to break the bank. So I'll have links to those down in the description of the video. These are the ones that we sell in my office, and they work incredibly well without being overly drying or irritating. Another mid-range brand that I'm a big fan of is ROC, R-O-C. They make a number of different ways to apply retinol to the skin, whether it's a stick, a cream, or a serum, and they have an option that'll definitely work for you, and it's well liked by dermatologists, so I highly recommend ROC as an over-the-counter brand. Now, if you want to splurge on retinol, I'm going to give you the one that I use every single night, and that is the Alpha Ret from Skin Better Science. The Alpha Ret Overnight Cream is retinoic acid, so it's the same molecule as prescription strength tretinoin, but it's also been formulated with lactic acid to create an entirely new molecule. Now, you might think that this is drying and irritating because it's prescription strength and it has lactic acid in it, which is an exfoliant, but there's something that the scientists at Skin Better have done with this that have made it incredibly non-irritating. I mean, I can't use prescription tretinoin anymore because it dries out my skin too much, but I have no problem using the Alpha Ret Overnight Cream, and most of the time I even skip a moisturizer when I use it. Shh, don't tell anyone. If you really want to go for it, the Alpha Ret Overnight Advanced has an even higher percentage of glycolic acid in it as compared to the regular Alpha Ret Overnight. Although these are pretty premium price points, they will last you 5 months. There's 150 pumps in the bottle and you use 1 pump per night. So for the price, if you think about using it for 5 months, the value is actually pretty decent. Now, in sharing some of these higher price retinols, I don't want anybody to think that you have to start there or that you have to eventually get there to a more expensive retinol. A $15 retinol used properly and consistently will beat a $150 retinol that's used wrong every single time. Now, even if you do everything that we've talked about in this video, you might still run into some challenges when you're introducing retinol into your skincare routine, so let me troubleshoot a few things for you. If your skin is getting too irritated, you may need to reduce the frequency of retinol application. Again, if you're using it once per week and then twice per week ends up being too much, go down to once per week for a little bit longer and give your skin more time to acclimate. If it's just not possible to go up to a higher frequency, consider lowering the strength of your retinol. After introducing retinol, you may say, I'm not getting results. This is where you need to ask yourself honestly, are you skipping it too often in your skincare routine? Because if you're not being consistent with it, you're not going to see results. Also ask, have you been using sunscreen? Because if you're skipping that morning sunscreen, the sun is more powerful than any retinol you can put on the skin, and it will negate all of the results that you're trying to get. And lastly, have you been patient enough? Because it really does take 3 to 6 months to start to see some significant results. Now, if you have a brown spot on the skin or deeper lines and wrinkles, retinol may not touch those. If you're not seeing any changes with brown spots, it could even be a good idea to have a dermatologist look at those and make sure that they're not something more concerning. Not all brown spots are created equal. Although most of them are going to be plain sunspots, you don't want to miss something more concerning, like a melanoma that can develop on the face. The third thing that I want to troubleshoot is if you start using retinol and you're breaking out more. You need to make sure that you're not using too many actives in your skincare routine. If you've also tried to introduce vitamin C or alpha hydroxy acids or beta hydroxy acids, simplify your skincare routine. Just introduce retinol until your skin gets used to it, and then consider adding other things when you've gotten into a good routine with the retinol. And because I know people are going to ask about it, can you use retinol while you're pregnant? Well, no, you shouldn't be using retinol while you're pregnant, and no dermatologist is going to actually recommend that. Retinoids can cause very specific birth defects, especially when they're taken orally, which is why when people take Accutane, they have to have 2 forms of contraception. That being said, there's not been any documented cases of retinoid birth defects from topical retinol that a mother uses while she's pregnant. But it's not something that you need to risk, and there are safer options in pregnancy if you're trying to maintain clear skin. What I really want you to take away from this video is that retinol isn't magic. It's a great skincare product that when used properly can improve the health of your skin and can improve the cosmetic appearance of your skin. However, you don't need to have the most expensive retinol in order to get results. You need one that your skin can tolerate and that you can use consistently. If you buy the most expensive retinol and you can't afford to buy it again next time, you're not doing yourself any favors. Get something that you can afford to purchase time and time again, and that is giving results for your skin. The skincare industry wants you to believe that you need to buy a more powerful and a more expensive retinol every time you exhaust your previous retinol, and that's simply not the case. Be consistent and you're going to see those results over time. So my challenge to you is, if you have not used a retinol in your skincare routine and you're ready to start, pick a gentle retinol that you can afford and get started with it. use it for 3 months and follow the instructions that we talked about in this video, going through that induction phase and making sure that your skin can get used to it. Once you've used it for about 3 months consistently, come back to the channel and let me know how it's working for you. What kind of results are you starting to see? If you're a longtime user of retinol, tell me about your experience and what your favorite retinol is down in the video comments. Now that I've clarified everything you need to know about retinol as a beginner, let me know what other skincare products you'd like to have a tutorial on, and I'll make video content on those in the future. Thank you for watching the video. Check out the recommendations in the video description, and I'll see you guys next time.